Recently, a cricketer had come to my OPD with pain in his back. The pain started a few months ago. Initially, he felt that it was a strain in the back and he continued to play. But progressively, the pain worsened match after match to a point that he was unable to bowl anymore. Back pain in an athlete may not be always a muscle strain. It could be a stress fracture of the spine. Hello everyone, welcome back to Spine Focus. Today we're going to talk about a very commonly missed injury of the spine in athletes. It is called as stress fracture or pars fracture of the spine. This part of the spine is called pars interarticularis. In sports like cricket, gymnastics, football, the athletes repeatedly bend their spine backwards and rotate their spine. This leads on to an injury to the pars interarticularis called as a stress fracture. Most of the times, the pain feels just like a muscle strain and the x-rays are often normal. The athlete continues to play, repeatedly injuring his spine, and the simple crack becomes a full-blown fracture. If you are a young athlete with back pain, you need to watch for these red flags. Pain in the lower back, especially when bending backwards or rotating the spine. Pain while playing. Pain continues to worsen if you have persistent pain which is more than 6 weeks in duration. If any of these symptoms persist, you need to do imaging of the spine in the form of a CT or an MRI scan to rule out a stress fracture. Treatment depends upon the timing of the diagnosis. If the diagnosis is made fairly early with rest, modification of the sporting activity, proper physiotherapy and rehabilitation, many of these fractures heal completely on their own and surgery could be avoided. However, if the patient presents late or if the medical management does not succeed, then we will need to proceed to a surgery called as a pars repair. In this surgery, the part where the fracture has happened is repaired directly without fusing the spine. This enables the athletes to continue with their sporting activities without any restriction in mobility of their spine. Sporting activity can be resumed within 3 to 6 months after the surgery. If a young athlete has pain in the back, especially on bending backwards, do not neglect it as a simple muscle strain. It could be a stress fracture. Early diagnosis is crucial as it can avoid surgery and at times save a sporting career.